my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery a month back and
you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist. And today we are live, and today we are before treatment live. Today date is 18th of August 2023, and with us Kim is here. Kim is having a kind of dysphonia, and you'll be listening in this live her voice before treatment. And in fact, in the future also we are going to do post-treatment live. So don't forget to subscribe our YouTube channel and press the bell icon so that after treatment, once we'll be doing live, you can watch that. So in this live, the topic which we are going to cover mainly will be introduction about me, about our center, about our YouTube channel, and you will be listening patient's voice here. Kim is here. Kim's voice, and what are the information required before starting the speech therapy or voice therapy, and kind of services we provide, vocal cord signs, symptom, cause, and treatment. And I'll be replying the answer of the question from those who will be asking during this live. So let's go one by one. So first is introduction about me. My name is Sanjay Kumar. By profession, I'm a speech language pathologist and audiologist, and I have studied from AIIMS, Delhi. The institute name is All India Institute of Medical Science, New Delhi, and it is in India. And the degree what I have in graduation degree name is Bachelor of Science Honors in Speech and Hearing, that I got from AIIMS Delhi, from All India Institute of Medical Science, New Delhi. And my master degree name is Master of Science in Speech Language Pathology from the University of Mysore. And my area of interest is treating voice disorder. So this is a small introduction about myself, and our center name is Sanjay Speech, Hearing and Rehabilitation Center, that is located in Bangalore, India. And from the year 2010, we are creating awareness about the non-surgical management of communication disorder, especially the voice disorder. And our YouTube channel name is SLP Sanjay Kumar Voice Therapist, that we started in the year 2010. From last 13 years, we are creating awareness with the success stories of the patient having different voice disorder with the pre and post treatment videos, and we are giving hope across the globe. So this is a small introduction about our YouTube channel. And now Kim, I'll be telling Kim, please unmute your mic and tell what exactly problem you are facing. What is your profession? Tell about yourself, how it is affecting your life.
I'm a teacher, second grade, and in 2019 I had a surgery to remove some polyps off my vocal cords, and my voice never really came back fully from that. And I've had a couple of surgeries, which they improve, but then it doesn't last for very long. And I had to have another surgery I would like to not have any more surgeries. I would like to work on therapy and other ways to help my voice. Before I decide, I may need to get out of my profession because it's just really hard.
I will summarize your story. First, you had the vocal cord polyp. For that, you went for surgery, and after that, vocal cord paralysis happened. Your voice went. Means you developed the voice problem that was not coming the voice, and then ENT finding was right vocal cord paralysis. I think if I am right, yeah, right vocal cord paralysis. For that, you went for injection theraplasty 2 times, but it was not much effective. Then you thought, let's try voice therapy. So this is your story. Okay, so we'll be helping you by the voice therapy, and so next I'm going to talk in this live. What are the information required before starting speech therapy? Especially this is in Indian scenario, and if you are taking help from any Indian speech language pathologist, you should know that. Like first you need to try to find out from which institute, which college or which medical college he has got the degree, and what is the name of full form of the degree, which year he got the degree, if he is registered in the Rehabilitation Council of India or not. If he is registered, what is the RCI number, RCI CRR number. If you also, somebody, some healthcare packs will also give RCI CRR number. So once you go to the Rehabilitation Council of India's website and click the CRR number, and then you can put the CRR number of that professional, you'll find the details. So if he registered or not, you will come to know that, especially in Indian scenario, I'm telling you, just to create awareness. And just before this, I have done one more live in that I have spoken in very much detail about how to find if you are taking speech therapy, that professional is a right professional or fake therapist. So my suggestion is just before this one live I have done, you can watch that. So you'll get more detail. Step by step I have followed the procedure. So I'm going to the next step, and kind of service we provide. So this is just for awareness, those who want to know what are the services available at our center. So please explore our YouTube channel playlist, and you will find different communication disorder playlist, and that will be having before treatment videos and after treatment videos. So we'll come to know that what changes was done, how much duration it took for that particular communication disorder. And if you are able to see any positive changes in our playlist, even I'll be suggesting, please share those playlists. Maybe it will be helpful for somebody having communication problem. And next is main important thing is vocal cord paralysis, sign, symptom, cause, and treatment. So the vocal cord paralysis sign symptom is very easy to understand, but the test will be confirmed. The test by which it will be confirmed is called laryngoscopy. When the patient will be having vocal cord paralysis, his voice will be, or her voice will be breathy, loudness will be less, and the patient will get tired after speaking few words or few sentences. The reason is that, for example, here the Kim is having the right vocal cord paralysis. So like if her right vocal cord is not moving effectively, so when you speak, or if I'm saying for example, both the vocal cord will come closer together and there will be a very small gap. So if her right vocal cord is not moving, so if left is coming towards the medial position when we are speaking, but right is not coming, so there is a gap, and in between gap, a lot of air is escaping, and because of the air escape, the amplitude of vibration of the vocal cord will be less. Because to vibrate the vocal cord, we put air pressure below the vocal cord to vibrate it, and now the air is escaping between these two vocal cords, so air is getting wasted. So that's why the voice will be, the vocal cord paralysis patient voice will be breathy, loudness will be less because amplitude of vibration is less, and the patient will get tired frequently because of the air wastage. In the voice therapy, what we do, we try to bring both the vocal cord. Suppose if it is right vocal cord is paralyzed, so there can be one situation we can stimulate and right vocal cord will start moving. There can be another situation where I will not be able to stimulate the right vocal cord. So in that condition, what we'll do, we'll bring the left vocal cord towards the right vocal cord. So the gap between these two vocal cord will reduce. We technically call phonatory gap. Phonatory gap will reduce and voice quality will improve. So this is the basic biophysics behind that. So if we can go in little depth also. So once we learn the speech production mechanism, it will be more easier for us to understand. So let's learn that also. For the speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cords. So once we put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth. These are known as articulators. For example, if you want to say paw, both the lips are coming closer together and touching each other. When you want to say ta, tongue is coming between the teeth. When you want to say ka, back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So once we say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord move like a string of a violin and guitar, sounds generate, we modify that sound into different sound. In one sentence, there are so many words, in each word there are so many sound, each sound its own place, own manner of articulation. So it is a little complex process. But in this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, fluency goes. That can be seen in case of a stammering patient or a stuttering patient. Of course, Kim is not having the stammering or stuttering, just for information I'm telling. If place of articulation is wrong, manner of articulation is wrong, there will be pronunciation problem. For example, for co-production, back of the tongue should be elevated. And if you are not lifting back of the tongue, you are lifting tip of the tongue, the sound will be something different. So that can be seen in case of misarticulation. I was just giving example of the cause sound. For each and every sound has own place, own manner of articulation. Like for paw production, both the lips should come closer together. For taw production, tongue should come between the teeth. So once we say a one sentence, so many things happen at a time. And thoughts come, we take breath, we put air pressure below the vocal cord moves, sounds generate, we modify that sound into different sound. In one sentence, there are so many words, in each word there are so many sound, each sound its own place, own manner of articulation. So it is a little complex process. So here we have larynx. Inside the larynx, we have two string-like a structure known as vocal cord. So once you put air pressure below the vocal cord start moving like a string of a violin and guitar and sounds generate. So those, like sometime what happened, during surgery or sometime during trauma, sometime during bacterial infection, sometime during viral infections, sometime idiopathic, we don't know exactly the reason. The nerve which supply to the vocal cord, technically we call recurrent laryngeal nerve, that is the branch of vagus nerve, 10th cranial nerve, get damaged. And because of damage of the recurrent laryngeal nerve, the movement of the vocal cords get affected. Sometime it will be restricted or sometime the vocal cord movement will be stopped. So it may be sometime unilateral, sometime it may be bilateral. So here in case of Kimberly Wells, in case of the Kim, right vocal cord is paralyzed. So for in the voice therapy, our goal will be to just stimulate the paralyzed vocal cord to move or to bring the normal vocal cord towards the paralyzed vocal cord so that phonatory gap, air gap between two vocal cords should reduce and the voice quality should improve. Because once the gap will reduce, the air wastage which was happening earlier will reduce. So the air will be more used to vibrate the vocal cord and amplitude of vibration of the vocal cord will increase. So loudness will increase, the breathiness will reduce, and overall I can say the voice quality will improve. But in your case, there is one small challenging situation is there. You had a vocal cord polyp and the vocal cord polyp surgery was also done. So what happens even if you are doing the surgery, for example, the vocal cord is two string-like structures. So suppose some polyp was there and the surgeon has removed the polyp. So during the healing process, it is not necessarily both the vocal cord will be in exactly the same mass. The reason is that because of the healing process, it may be slight deviation can be there in the mass of the vocal cord. And if any string vibrate, the frequency and it may depends upon, like there is a one relation called n is equal to 1 by 2 L under root T by M. So here n is the frequency, L is the length of the vibrating string, T is the tension, M is the mass per unit length. So both the vocal cord will not be having exactly the same mass. If in that case, say similar exactly the same length, it is not necessarily, maybe after the surgery some slight alteration can be there. So even after therapy, if the vocal cord is getting stimulated or maybe the gap we are reducing, so both the vocal cord will not be exactly in the unison. So what will happen, there may be slight hoarseness also can be there even after the therapy. But what I am just trying to do to bring the vocal cord more closer together so that at least we can reduce the phonatory gap, at least we can increase the amplitude of vibration of the vocal cord and loudness we can improve. So time will give the answer how much I'm going to help Kimberly Wells. I want good wishes from my YouTube channel viewers, your wishes, so I will be able to help and I will do my best. And so those who are watching, please subscribe our channel and don't forget to was the post-treatment like? Because this is a very new story. She had the history of vocal cord polyp, and now she's having the vocal cord paralysis. She went for injection thyroplasty 2 times, 1 time vocal cord polyp surgery, almost 3 times she has gone for surgical procedure, and now she's fed up with the surgery, so she don't want. Okay, so this is the story of Kim, and we'll be helping her. And yeah, so this was the main topic I wanted to cover, and I'll be just checking if any question those people who are watching they have, I'll be answering. So before that, maybe some people has joined newly. So Kim, just tell us what exactly problem you are facing, how it started, where you stay. Just to give a small introduction. I'm just muting my mic.
I'm just hoping to get some of my voice stronger so that I can continue teaching without the surgeries. There's one more surgery that he would like to do. Is very invasive, and that's, to me, it's not an option. So I'm excited to start some voice therapy to see if we can make my voice a little stronger, even if it's not perfect, better than what it would be by facing the surgery. So I'm excited to see what could come of this.
Okay, thanks, Kim. We'll do our best, and I'm just trying to see any questions are there during the live chat. I'll be answering those questions. So maybe some questions will be in Hindi, in my mother tongue. So just maybe you will not be understanding, but I need to answer. Okay. So there is something Gunbi is saying, में laryngitis present है after 2 months, but therapy के बाद काफी change आया है. So I'm not understanding what exactly he want to say. That he was saying laryngitis. Laryngitis is infection in the larynx, so that will be more controlled by the physician, like ENT doctor, and they will give some medicine for infection. So laryngitis, I don't think voice therapy will be helping much. But from my side, I can suggest some vocal hygiene, drink plenty of water, avoid shouting, don't speak too much if you have a laryngitis during that time. And the Daisy Narang is saying, hi Dr. G, hi Daisy Narang. Amit Bairwa is saying, sir, aap kahan se ho? So our center is in Bangalore, and so please refer the description of this video, and you'll find our website. Click the reach me, then you'll find our on the Google map where is our clinic situated, contact number, email ID, etc. So please refer the description of this video to know where I stay. मतलब मैं कहाँ पे रहता हूँ ये जानने के लिए सिर्फ वीडियो के डिस्क्रिप्शन में जाइए, हमारे वेबसाइट को क्लिक कीजिए. और डेजी नारंगी सर मेरी थर्डेक्टमी हुई है 1 महीने पहले. So Daisy Narang, please call us. We'll do the perceptual evaluation, and then we'll be able to comment on your voice problem, and we'll try to help you if it is needed. Amit Barwa is saying, sir, मेरी भी आवाज़ लड़की की तरह निकलती है, sir. So Amit Barwa, I don't know you are what is your age. So if your age is more than 14 or 15 years, so at that time your voice should be more masculine, or if it is a feminine kind of voice, so you may be having a certain kind of dysphonia. So please call us. We'll do the perceptual evaluation. If needed, we'll suggest some tests, and then we'll be able to guide you in more effective manner. तो आप हमें कॉल कीजिए अमित बैरवा, और आपकी आवाज़ को सुनेंगे, समझेंगे, फिर आपको हम गाइड कर पाएंगे. एंड डेजी नारंग लिखते हैं वोकल कॉर्ड पैरालिसिस है. तो डेजी नारंग वी हैव सीन हमारे क्लिनिक में वोकल कॉर्ड पैरालिसिस के केसेस में वॉइस थेरेपी के माध्यम से कई बार काफ़ी अच्छे रिजल्ट देखे गए हैं. तो आप हमें कॉल कीजिए और आप हमसे हेल्प ले सकते हैं. हम लोग परसेप्चुअल एवोल्यूशन करेंगे. अगर कुछ मेडिकल रिपोर्ट्स होगा तो भी आप शेयर कर सकते हैं. और अमित बैरवा लिखते हैं, सर कोई उपाय बता दो. तो यस, प्लीज़ कॉल अस. विल डू द परसेप्चुअल एवोल्यूशन, देन विल बी एबल टू गाइड यू. And so thank you all for joining us and watching us. If you have any question, please write in the comment box. Just Kimberly Wells, just you can keep telling about your problem. I'll just join in 1 second. Okay. Just by the time you can keep telling about your problem.
Okay, I just have a problem with breathiness. and my voice is very weak. I don't have a lot of loud sound coming out. When I'm teaching in class, I need a voice amplifier to make my voice strong enough, and unable to speak in large rooms or in the gym. No one can hear me. If I'm around a lot of people or in a restaurant, I can't really speak.
Okay, thank you, Kim, and we'll do the needful. You can mute your mic. So I'm just seeing any questions are there. I'll be answering. So someone is saying अभी हॉर्स वॉइस आ रहा है. डेजी नारंग इज सेइंग अभी हॉर्स वॉइस आ रहा है. तो डेजी नारंग आप हमें कॉल कीजिए, हम परसेप्चुअल इवोल्यूशन करेंगे, फिर आपकी आवाज़ को समझने की कोशिश करेंगे, फिर उसके बाद हम सजेस्ट करेंगे क्या नेक्स्ट करना है. और थैंक यू ऑल फॉर ज्वाइनिंग अस एंड वॉचिंग अस. अगर आपके मन में कुछ और भी क्वेश्चंस हैं तो आप कमेंट बॉक्स में लिखिए, हम लोग आंसर करने की कोशिश करेंगे. एंड तो वोकल कॉर्ड पैरालिसिस का एक स्पेशल प्लेलिस्ट है. तो डेजी नारंग सेशन आपके लिए ये है कि आप उस प्लेलिस्ट को आप देखिए, उसमें बहुत सारे पेशेंट्स के बिफोर एंड आफ्टर ट्रीटमेंट वीडियोस होंगे. उसको देखेंगे तो आपको मोटिवेशन मिलेगा, होप मिलेगा, और फिर जो है आप हमसे कांटेक्ट भी कर सकते हैं अपने मेडिकल रिपोर्ट्स के साथ, और हम लोग आपको गाइड करेंगे. और सबसे पहले आप हमें कॉल कीजिए परसेप्चुअल इवोल्यूशन के लिए. तो थैंक यू सो मच फॉर ज्वाइनिंग अस एंड वॉचिंग अस. तो थैंक्स वेल्स एंड किम्बली Wells, thank you so much for coming for live and getting agree for live. It may be helpful for people to create awareness about the dysphonia due to unilateral vocal cord paralysis. And in fact, we are going to do post-treatment live, so that is also going to help many people if changes are happen, and hope there will be some positive change. Thank you so much. And thank you all for joining us and watching us. Thank you all. Love you all.